Dr. Marshall here with Medical Specialty Clinic. Today, I'd like to do a video and let you know a little bit about Berberine. So Berberine is an excellent supplement, and a lot of people take it and get significant benefits to several health conditions from it. So it is actually an alkaloid from a plant that I believe is native to China. The plant that it comes from is called Coptis chinensis. So berberine has been used in Chinese medicine for thousands of years. And now I think the evidence is pretty clear that there's several health benefits from it, particularly with metabolism and diabetes. A lot of people will take it to help lower their blood sugar. So if you're diabetic and you're having trouble getting over the hump, getting your blood sugar down just a little bit more, or having a little difficulty losing weight, then berberine can be a good supplement to help. I will actually post some references at the end of this video that you could look at so you can do your own research. But there's been multiple studies done using berberine and shown significant changes in disease states. It's very interesting that it is also used with chemotherapy. Berberine actually can inhibit the growth of certain types of cancer cells. Studies have shown that when you put it together with chemotherapy, it actually improves the safety of the chemotherapy and the efficacy of the chemotherapy. So the chemotherapy actually works better when you add berberine to the treatment. So if you're undergoing chemotherapy, I would certainly recommend that you discuss adding a berberine supplement. Don't do that without discussing it with your doctor, as usual. Of course, as always, just a little disclaimer here since I mentioned that. Discuss taking any supplement with your healthcare provider before you start it. For some people, it could be safe, and for others, it could be very dangerous to take together. So always discuss that with your healthcare provider first. But anyway, back to the berberine discussion. So can definitely help with chemotherapy in certain types of cancer treatment. It can help with metabolism and efficiency, in which we use sugar, so very beneficial in diabetes. It can also help with PCOS, so polycystic ovarian syndrome. Typically, there's a lot of insulin resistance in that condition, and it's been shown in studies to actually help with that too. Also, it can help lower your cholesterol. So you take a supplement that helps improve insulin resistance, lower blood sugar, and lower your cholesterol. That should be a healthy option. So just think about that. If I could give you one medicine with a prescription that would do that, that would probably be a good place to start. So this you can take, very few side effects, over the counter, and typically very well tolerated. Another great benefit is that it can help with digestive health. It works two different ways to help. So it can actually help inhibit some bacterial growth in the intestine. So it can help with Helicobacter pylori, which is a bacteria that can live in the stomach and cause ulcers. So if you have problems with acid reflux, indigestion, certainly if you have peptic ulcer disease, gastric ulcers, then berberine would be a good option. And then on another side, it also helps with digestive enzymes and digestive health overall. So on top of that, berberine can also help lower your blood pressure. It improves cardiovascular dynamics in the body. So one study showed berberine together with a blood pressure medicine called amlodipine lowered blood pressure better than amlodipine by itself. When you look at this, overall, the benefits you got: it can lower your blood pressure. It can lower your blood sugar. It can help you lose weight. Studies done looking at PCOS have also shown that it can improve your hip to waist ratio, which I think almost everybody in America would like. Then it can also help with acid reflux treatment. So you could potentially take that with or instead of some of the more potent prescription drugs like proton pump inhibitors for acid reflux. And it's an antioxidant, so it can help with inflammation and lowering inflammation in the body. Just wanted to do a video. I think this is a good supplement. Wanted to share some information with you. This medicine can have several health benefits, and I wanted to make sure that at least that had been mentioned. So now on to dosing. So typically berberine is taken at 500 milligrams to 1500 milligrams a day. Most of the supplements, it's about 1000 milligrams or 1 gram a day. You can divide it up through the day, but I think some of the more common options just give you about 1000 milligrams a day. And it comes in different forms. Some are a little more readily absorbed from the digestive tract, but generally if you get a good quality manufacturer that does some outside testing on their products to make sure they actually contain what they say they contain, then I think you'll be fine. One of the downsides to this can be that it can interact with some other medications, so that's another reason you want to discuss it with your healthcare provider before starting it. But berberine can inhibit some of the cytochrome P450 enzymes, and those are involved with metabolism and elimination of some prescription medications, or actually several prescription medications. Many things are metabolized with cytochrome P450 enzymes, and that's quite a complicated system. So if you're on several medications, some of those are likely metabolized to that cytochrome P450 system. So you want to make sure that you're not taking something that can affect the levels or activity or efficacy of a prescription medicine that you're already taking. Anyway, just a couple of points here on berberine. I hope you enjoyed the video. If you did, please like and subscribe. And if you have any questions or would like to make an appointment with one of our providers, just give us a call at the office, 731-257-1500. Look forward to seeing you in the next video. Thank you very much.